Let's touch a bit upon lactose intolerance. Do you see a lot?
Yes, it is common. It is common all over the world. So we have to understand lactose intolerance, self-diagnosed, is more common than actual lactose intolerance. Lactose is made of glucose and galactose,
Right.
beta 1,4 linkage. Lactase is the beta glucosidase which breaks it into glucose and galactose, and then they are absorbed.
Right. So lactase is the enzyme that you need.
Which is present. So if you look at the small intestine, so for our viewers, what is the difference between small intestine and large intestine? It's not the length. It's the diameter.
Diameter. Right.
The small intestine is longer than the large intestine, and if you take out the small intestine, put it on the ground, it is almost as long as a tennis court.
Yeah, size of a
6 to
football
8
club.
meters.
Yes, yeah.
So small intestine, the lumen is small, but the absorptive area is enhanced by villi,
Correct.
and at the top of the villi, there's microvilli.
The villi is a finger-like projections.
Yeah. So these have an enzyme called lactase, which breaks them down. It is seen with aging, the lactase level drop, and the ability to break down lactose decreases. So this lactose goes to the large intestine, where the anaerobic bacteria ferment it.
Correct.
And that fermentation produces gas. Active metabolites which pull water causes diarrhea. This is the actual lactose intolerance, which is called primary lactose intolerance. Has to happen at some age. Like I remember with my parents in North India, they used to say that milk doesn't suit me anymore, so I have tea. That was the classical soft definition of lactose intolerance. Right? So this will cause bloating also because of the fermentation, everything. So this is one. How do you diagnose it? Two important tests: stool pH, because of the fermentation. Stool pH drops acidic, less than 5.5, and hydrogen breath tests, which are a little complicated. Will not be telling to my viewers, not important. So these are two things. But you have to understand, not all dairy has to be avoided because of 2-3 important reasons. See, even if you're lactose intolerant, 12 to 15 grams of lactose per day, according to science, is digestible. That is around 250 ml of milk. The major problem comes from full cream milk, right? Or the buffalo's milk,
Correct.
which is high in fat, high in lactose. But as it is fermented or it is condensed, the amount of lactose decreases. So when you ferment it to curd, the lactose decreases, and you have live lactobacilli in curd, which are fermenting lactose even before it goes in. So curd is normally in proper doses, 1 to 2 bowls in a day, is even with primary lactose intolerance digested, tolerated. Similar with paneer, and these things are absolutely different. They are enzymatic condensations. So they should always also be properly digested. And with cheese, again, it should be digested. There should be no issues. The lactose content is going down. The fermentation and enzymatic condensation is reducing the lactose content. So this, again, cool thing that I am lactose intolerant and staying away from dairy in a vegetarian population like ours is again a problem. So this should be very clearly brought out in front of the public that yes, lactose intolerance is common, but self-diagnosed lactose intolerance is more common than the actual lactose intolerance in our public.
Have you prescribed lactate tablets?
I don't think they work. I haven't. With multiple studies I have looked into, I don't think they work.
And in my practice, many patients with IBS has some kind of a lactose intolerance symptoms.
That is
when
common.
they come.
That is common.
But when we treat them with the proper diet, proper stress management, after 2 to 3 months, the symptoms get better.
Yeah.
They will not be able to handle a full scoop of ice cream before, but after that, they'll be able to tolerate half. So that was the beauty of thing what I introduced was, it's all comes down to basics in terms of how do you structure your lifestyle.
So yes, we talk to our patients like with lactose intolerance. I have seen people with vegetarian, all these multiple issues. I ask them for 3 food combinations in my clinic. Like I told you, for Indians, I think, please, with your spinach, with your pulses, with your rajma, with your chole, please squeeze lemon into it. One, right, to increase your
Availability of iron.
the non-heme iron absorption increases. Second, take 2 spoons of chia seeds with curd every day. And the third is the popular haldi, turmeric with black pepper, because curcumin is not absorbed as much without black pepper. So always mix black pepper, 2000% increased absorption of curcumin is seen when you mix them. So these three combinations in my population becomes very important for gut health. I've seen patients improve. I've seen patients feel better. I've seen patients be more aware of themselves, having more confidence in me than anything else. So I think these three combinations I would like to tell all my viewers.